Today, Tom and I will be presenting an overview of the federal regulations that oversee research involving human subjects, with a focus on social, behavioral, and educational, or SBE research. This presentation is based on the CITI Program module, and it explains why these regulations exist. We're going to talk about what the common rule is and how institutions and agency apply these these regulations in real research settings. So the primary purpose of the federal regulations is to protect the rights, the welfare, dignity, and well-being of human subjects involved in research studies. These regulations ensure that research is being conducted ethically and that any risks to participants are both minimized and reasonable in relation to the potential benefits of the research. And then another key purpose is to maintain public trust, because when research follows federal standards, it's going to help ensure that transparency, accountability, integrity, things like that are still upheld within the research process. And then it's also important to note that federal regulations establish minimum standards. So essentially what this means is that institutions are allowed to supplement these standards with additional policies if they choose to do so. So the primary federal regulation governing human subjects research is 45 CFR 46, which is issued by the U.S. Department of Health and Human Services, or HHS. The term 45 CFR 46 is specifically referring to the regulation's location in the Code of Federal Regulations. And then there's going to be three different other subparts that we're going to talk about. But for now, subpart A of this regulation is commonly known as the common rule. So although the common rule remained generally unchanged for many years, major revisions were finalized in 2018 by HHS and more than 15 other federal agencies. These revisions were designed to reduce administrative burden, to strengthen informed consent and protections for human subjects, as well as just increase flexibility for modern research. The revisions also expanded exempt research categories and updated requirements for informed consent and IRB operations. So before moving on, we're going to talk about these other three subparts of the 45 CFR 46. And these are protections for vulnerable populations specifically. So subpart B is in reference to pregnant women, human fetuses, and neonates. Subpart C, prisoners, and then subpart D, children. And these three subparts recognize that certain populations may be more vulnerable to coercion or harm, and therefore require additional safeguards. Several key agencies play a role in enforcing and overseeing federal research regulations. So HHS enforces these regulations essentially to ensure that research, again, is being conducted ethically and that human subjects are always protected. Within HHS, the Office for Human Research Protections, or OHRP, provides leadership and oversight related to human subjects protections. So institutions conducting federally supported research must file what's called an insurance with OHRP, essentially that stating that they agree to comply with the federal regulations. And then finally, IRBs, or institutional review boards, are responsible for reviewing, approving, and overseeing research involving human participants at the institutional level. And to talk a little bit more about the IRB, which is an independent committee established to protect the rights and welfare of human research subjects. Depending on the institution, an IRB may also be called a research ethics board or an independent ethics committee. IRBs, they conduct different types of review. So exempt review, this applies to low risk research that fits specific regulatory categories. Expedited review, this is used for research involving no more than minimal risk and is conducted by one or more IRB members. And then lastly, convened or full board review is required for research involving greater than minimal risk. And for this one, the majority of IRB members will be present. And IRBs, they have the authority to approve or disapprove research, to require modifications, to conduct continuing reviews, as well as to suspend or terminate approvals. So, according to federal regulations, research is defined as a systemic investigation designed to develop or contribute to generalizable knowledge. So, this includes structured inquiries that use planned methods for collecting and analyzing data, research involving human subjects, when investigators interact with individuals or collect identifiable private information. This is especially important because when private information is collected, it can be linked to a specific individual. So, obviously, ensuring that confidentiality is maintained and protections are thus needed. And then, lastly, certain types of research are considered exempt from full IRB review or some provisions of the Common Rule, but they are still regulated. So, common exemptions in SBE research include educational tests, surveys, interviews, and observations of public behavior, to name a few. Importantly, the determination of exemption is made by the institution, not the researcher. Researchers cannot self-exempt their studies. And then some exempt studies also require a limited IRB review to ensure that privacy and confidentiality protections are adequate. And then moving on, Tom is going to discuss a relevant case study.
Great. Thank you so much, Liz. Really great review of the Federal Regulations and Research module. So hi, everyone. As pointed out in the earlier modules, we didn't always have the protections in place for human subjects in research. The Tuskegee syphilis study in 1972 was a really great example of this, but it also served as a catalyst of the Belmont Report in 1979. So this established those ethical principles as our guiding compass in conducting research and really became the foundation for the federal policy for human subject protection, known as the Common Rule that Liz obviously just explained earlier. So as AI is exploding and changing the way people conduct research on humans, it does, however, pose risks that our regulatory frameworks have not quite kept up with yet. So, after doing some research, we came across a proposed class action lawsuit filed in the San Diego Superior Court that claims Sharp Healthcare, which is a large health system in California, secretly recorded conversations between the patients and the healthcare providers during medical exams using an AI tool called a bridge. And this was done without notifying patients or securing their consent. So in this article, which you could read, the complaint starts with Sharp began using the AI app in April of 2025 to capture that exam room dialogue and generate draft clinical notes. And the lawsuit states that the technology captured really comprehensive details, which include the symptoms, diagnosis, and personal information, and then transmitted that audio to an external server where a vendor actually had access to this personal data. So patients were allegedly never informed that their visits were being recorded, were never allowed to be consented or opt out, as all of this is required under California consent laws. So with that being said, let's go to the next slide. Thank you so much. We do have a few questions for all of you for this week. So question number one, based on the federal regulation module that we just reviewed, what kind of risks do we face as our data is being bought and it's being sold and used by these AI systems? Question number two, if the Common Rule defines human subject research as activities involving identifiable private information, should large-scale AI training on personal data where individuals obviously never consented being treated as human subject research? Why or why not? Last but not least, how does the lack of informed consent and the potential for re-identification from AI change the ethical obligations of researchers and institutions compared with the traditional way of doing human subject research? So, those are our three questions for the week. Thank you so much for your time, and we look forward to seeing your responses this week. Thanks so much, Liz.